The basics of collecting social status of a patient is to ask for their name, age, occupation, and accommodation. By asking these questions, it would ease the communication between patient and doctor. If a patient is a child under 13 years old, certain information can be obtained from their parents or their legal guardian. When dealing with a child, a doctor should understand the difference between communicating with a child and an adult. For as a child who are more playful and have a shorter attention span, a doctor needs to be more patient and using kinder words to the child. As for patients who have mental disability or psychotic behavior, communication and obtaining certain information may be difficult. In this process, you may obtain information from their legal guardian. If, however, the patient is unconscious, for example, during an emergency situation or a recent trauma, you could refer to their identification card or their passport. If during an emergency situation outside of the hospital, a patient is unconscious, the doctor may ask for any available bystanders who would know this information regarding the patient. The doctor may also ask any bystanders to what happened to the patient, as in to identify any recent trauma that has happened to the patient. The main complaint is a complaint that a patient may present to you, and based on these complaints that was present, additional detailed questions through a systemic review can be asked to the patient for a better diagnosis. For example, if a patient has complaints regarding their respiratory system, the doctor may ask these following questions. Is there any difficulty in breathing? Are you breathing through your nose? Is there any running nose? Cough, sputum, blood spitting, pain in the chest? Is there any shortness of breath, and etc. As for the cardiovascular system, shortness of breath, palpitation, any irregular heartbeats, any pain or discomfort, pulsation or any edema. As for genital system, also depends on the gender of the patient. For a woman, you may ask about their menstruation, what age did they get their menses, is it regular or irregular, and the duration and also the amount of menstruation. As for the digestive system, a doctor may ask the patient regarding their appetite or the distinguish of taste of food. Is it unpleasant, bitter, sour, sweet, or metallic, or is there absence of taste? The feeling of dryness, thirst, swallowing, is it easy, difficult, or painful? The passage of food, any belching, eructation, any heartburn, nausea, vomiting, pain in the abdomen, flatulence, stool, and also in cases of constipation and in cases of diarrhea. For the urinary system, the doctor may ask, is there any pain, and check for edema, may ask regarding urination, the number of urinations in the day of time and also night, and also the color of the urine. For the osteomuscular system, the doctor may ask, is there any pain in the bones, pain in the joint, and muscle pain. And when these pains are present, you may ask the character of the pain, the intensity of the pain, the relation to the time of the day of the pain. And by asking these detailed questions, a better diagnosis may be obtained. Additional complaints can also be obtained by asking the patient regarding, is there any fever, dizziness, fatigue, weakness, mood swings, sweating, pain, sleep, weight change, and appetite, or recent traumas. Therefore, by collecting these information, the psychosocial status, chief complaints, and additional complaints, it is the aspect of a subjective information. A doctor should be in proper etiquette and also proper attire. In the next video, we will show you how a doctor presents herself while collecting these informations from a patient.
Come in. Hi. Please sit.
Thank you, doctor.
What is your name?
My name is Jennifer.
And what is your age?
37 years.
And what is your occupation?
My occupation is work office.
Okay, where do you live?
I live in Karl Marx.
So in Kursk, right?
Yes.
So what brings you here?
I have here pain here in my stomach.
Where exactly do you have the pain?
I have all doctor.
Okay, everywhere in the stomach.
Yes.
So the pain, what kind of pain is it? Is it very strong?
It is very strong.
Okay. So when did it start?
2 days ago.
Okay. So the pain, is it constant or it comes and goes?
Yes, 2-3 times.
Okay, so it comes and goes in every 2 to 3 minutes.
Yes.
Okay. Take any medicines
Yes, I use ibuprofen.
and it does not ease your pain.
Yes, it's no resolve. I come here because I continue with strong pain.
Okay, so you decided to come because of the strong pain. Did you have any trauma, any injury?
No.
No. Do you have any other problems?
Yes, I have vomit.
How many times did you vomit?
4 times.
Okay. And what color is your vomit?
I think it's normal, doctor.
Okay, so it's just the food you ate.
Yes.
Did you eat properly?
No, I have no appetite.
Okay. Do you have fever?
Yes, I have fever.
When did you check your fever?
I check it today, 38 even.
Okay, so it was 38 in the evening. And can you pass stool regularly?
No, I have no stool for 2 days.
Did you have gastric ulcer?
Yes, I have.
When did you have?
5 years ago.
Did you consult a doctor?
Yes, I go for doctor. Doctor pass medicine for me, but I know it.
So you did not take any medicine for the gastric ulcer?
No.
Okay. Do you have any allergies?
No.
Any blood transfusions?
No.
Do you smoke?
Yes, doctor, I smoke.
How long have you been smoking?
10 years.
For 10 years, okay. So do you drink alcohol and
Yes, I
use
drink.
drugs?
Yes.
Do you have diabetes?
No, I don't have.
Any operations do you have?
No.
Tuberculosis?
No.
Stroke?
I know.
Myocardial infarction?
No, doctor.
Do you have any family history of gastric ulcer? Any of your parents had gastric ulcer?
Yes, my father. My father have gastric ulcer.
When was your last period?
Last weekend.
Okay.